Okay, ma'am.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how are you going to manage this patient now?
Okay, ma'am. According to the scenario, I'll manage the patient according to the ABC protocol. I'll
Yes,
check the airway, breathing, and circulation. In circulation, I'll check the pulse, blood pressure, and urine output. I also give the catheter of this patient to monitoring the urine output. And this patient, I will manage in the HDU or ICU and give it and check the chart review, short history and examination, and I will provide furthermore investigation and manage the patient in need the cardiac monitoring and
yes,
stop the potassium containing fluid in this
fluid.
patient.
Yes, immediately.
Yes,
And yes, what else are you going to do?
yes, ma'am. Regarding the scenario, patient having the high potassium level,
Yes,
creatine also raised, and dementia, I'll consider this patient needs the hemodialysis. Before this, I will give the calcium gluconate 10 ml 10% over 10 minutes for cardiac safety purpose. And I also consider the 5 to 10 ml 50 ml units 50 ml of 50% dextrose uh, of the patient, and consider the sodium bicarbonate, and I can also give the calcium resonium and as well as the uh, calcium resonium and the salbutamol solution. Then I'll consider the hemodialysis of this patient.
okay. After you've read the stem and considered the labs which are mentioned in this stem, how are you going to interpret this? What would be your provisional
Yes,
diagnosis?
ma'am. This patient may suffer from the acute kidney injury.
Okay. When you have to discuss about the kidney injuries, how are you going to classify them?
Yes, ma'am. The pre-renal, renal, and post-renal. The pre-renal due to the vomiting or the severe hemorrhage, and the renal cause may be the glomerulonephritis or drugs, NSAID, and the post-renal there is obstruction of the urinary flow, the stone in the urinary system, or bladder carcinoma.
According to your opinion, which condition is this one?
This patient was suffering from the post-renal
Impairment.
acute kidney injury.
Okay. Most of the most of the uremic patients also present with anemia. What type
Yes,
of
ma'am.
anemia do they present
Yes,
with?
this patient suffering from the normochromic normocytic anemia, ma'am.
Due to the deficiency of what?
Due to the deficiency of the erythropoietin and the presence of circulating bone marrow toxin and the bone marrow fibrosis due to the osteitis fibrosis cystica, and the increased red cell fragility due to the uromic toxin.
Okay. Uh, all right. Potassium is 8 millimole, which is considered high. What might have led to this condition?
Yes,
What could
ma'am.
be
Due
the
to the
causes?
yes,
Yes.
yes, ma'am. Uh, Ma'am, a complication of raised potassium or causes of raised potassium, ma'am?
Uh, Presence of high potassium in this
Yes.
scenario.
Yes, patient may some complication arise like the already having the hyperkalemia, patient may develop the high metabolic acidosis, then the fluid overload, that is the pulmonary edema, chronic renal failure.
Okay, renal failure could be the
Yes, ma'am.
cause. Okay, because there is no history of, okay, there is history of urinary tract infections, but there is no other history of medications given in the stem.
Yes, ma'am.
Right, okay. Please tell me, when would you consider the patient ideal for hemodialysis?
Yes, ma'am. There is some reason for doing the hemodialysis. First, the if patient having the hyperkalemia, potassium more than 6, and the metabolic acidosis, that is the pH less than 7.2, patient having the urea more than 30, fluid overload, creatinine clearance less than 10 ml per minute, and the uremic encephalopathy.
Good. So, what are the ethical considerations that you have to keep in your mind,
Yes,
especially
ma'am.
for this patient when you
Yes, ma'am. The
consider that
patient,
patient is dementiac? Yes.
yes, ma'am. This patient is dimensioning, but for his life safety purpose, I have to go through the hemodialysis. And in this case, I will take the signature from two consultant, that is the consultant for Form 4.
Four.
And I
Very good.
also involve the caretaker of his residence, the GP, GP and the nurse of the hospital.
Okay. Can you give me some causes of renal failure? And in that case, acute renal failure, not chronic renal failure.
Yes, ma'am. The dehydration, that is the vomiting or hemorrhage, the ducts, NSAID ducts, the some obstruction of the urinary flow may cause the renal failure. Then crash injury,
Mm.
hemolysis.
Mm, yes, okay. Hemolysis is also one of them. Yes, but metabolic conditions like
Yes,
diabetes mellitus.
metabolic
Mm,
acidosis, ma'am.
okay, right. Potassium. All right, you've told me. Okay, what are the complications that can result because of acute kidney injury?
Yes, patient develop the pulmonary edema,
Very good.
metabolic acidosis,
Yes.
chronic
Uh,
renal failure.
yes. Please tell me why potassium is important for homeostasis.
Yes, potassium is very potassium maintain the fluid balance in our body, nerve conduction, the muscle function, and the cardiac function.
Um, okay. Right. How much potassium is required according to the NICE guidelines for
Yes,
an adult to take in everyday diet?
in Western country, 20 to 100 ml uh,
No, not
potassium
100 ml, millimole
sorry, ma'am, millimole in diet per
daily per day.
daily per day.
Okay. Right. Right. What hormones play major
Yes,
role
ma'am.
in homeostasis of a person's?
Yes, the aldosterone and the insulin, ma'am.
Aldosterone, okay.
And
Insulin, all
aldosterone,
right.
yes.
Right. What is the renal function? Like, what is the renal function when it comes to act as a buffer or maintain the acid base balance? How kidneys function?
Renin, angiotensin, and aldosterone system.
Yes. And how does it work?
The aldosterone causing the absorption of reabsorption of sodium, excretion of the potassium, maintain acid base balance, and BP maintain.
Potassium along with hydrogen ion as well.
Yes,
And
yes, ma'am.
another number two, their function, how do they work on
Yes,
tubular flow?
metabolic acidosis in the renal system, metabolic acidosis causing the hyperkalemia, and metabolic alkalosis causing the hypokalemia, ma'am.
Okay. And what are the cardiac effects of potassium that you as a surgeon should know?
Yes, ma'am. In the ECG, I'll find the wide QRS complex, peak TOF, flat POF, and the dysrhythmia of the patient, hypotension, and the cardiac arrest.
Okay. Right. Thank you.
Thank you, ma'am.